Welcome to Coverage Confessions. My name is Mari Martinez, and here we break down the truth about health insurance one real story at a time. So in less than 20 minutes, we're going to clear up confusion, expose common mistakes, and help you make smarter Medicare decisions. Whether you're new to Medicare or just trying to avoid costly pitfalls, you are in the right place here. So let's get into it. Today's confession comes from a listener named James who wrote to me saying, I just turned 65 and Medicare feels completely overwhelming. I don't know what parts I need, when to enroll, or if I should wait. I'm worried about making a mistake. James, trust me when I tell you, you're definitely not alone. Medicare can seem complicated, but let's break it down together step by step. First, let's clearly break down the different parts of Medicare because this is often where people feel the most confusion. So we're going to start with Part A, which is hospital insurance. This covers inpatient care at hospitals, skilled nursing facilities after a hospital visit, hospice care, and some limited home health care. If you have worked and paid Medicare taxes for at least 10 years, which is 40 quarters, you typically won't pay a monthly premium for your Part A. But here's something important that many don't realize. Part A has a deductible of $1,676 in 2025 per hospitalization benefit period, which means this deductible resets with each hospitalization. Now let's look at Part B, which is medical insurance. It covers doctor visits, outpatient care, preventive screenings, lab tests, and durable medical equipment like crutches, wheelchairs, etc. Unlike Part A, Part B has a monthly premium, which for most people, it is $185 per month in 2025, plus an annual deductible of $257. After meeting that deductible, Medicare generally pays 80% of your medical costs, leaving you responsible for the remaining 20%, which can be significant in case of major illness. Part C, also known as Medicare Advantage, are plans offered by private insurance companies that have a contract with Medicare. They bundle coverage for Parts A, B, and D, which we'll explain here in a minute what D is, into one comprehensive plan. Medicare Advantage often includes additional benefits like dental, vision, hearing, wellness programs, a gym membership, etc. They're designed to be an all-in-one alternative to original Medicare. This simplifies your coverage into one single plan. This is why I like to say Part C is for combo, because it's like getting the burger, the fries, and the drink all in one nice package. Medicare Part D helps you cover prescription medication costs. So Part D plans, they vary significantly in terms of monthly premiums and formularies, which is the list of all covered medications in that plan. In 2025, Part D made a significant change, which is a $2,000 annual out-of-pocket maximum, meaning once you pay that out-of-pocket costs, it reaches that amount, then you pay nothing more for your prescriptions for the rest of the year. Understanding these parts is crucial. Many seniors actually think that Medicare automatically covers everything, and nothing could be farther from the truth. And then they face unexpected medical bills later. It is essential to fully grasp these basic concepts clearly so that you can confidently choose coverage that best fits your specific needs. Now, let's thoroughly address the consequences of missing enrollment deadlines because unfortunately, timing matters a lot. So let's first tackle Medicare Part B, which, as we said, covers doctor visits, outpatient services, and preventive care. But many people mistakenly assume that Part B enrollment happens automatically, but it doesn't necessarily. You typically have to sign up for it yourself unless you're already receiving Social Security benefits. If you delay enrollment into Part B without having other credible coverage like employer insurance, for example, your monthly premium will increase by 10% for every full 12-month period you were eligible for it but did not enroll. And this penalty lasts forever. So imagine waiting 3 years, you would pay an extra 30% each month for the rest of your life. So if you have questions about Medicare Part B while working past 65, please check out my episode that covers that specific topic. I will leave you the link right here. So prescription drug coverage is critical, and missing your enrollment window here is costly too. So Medicare adds a permanent penalty to your monthly Part D premium if you go without credible drug coverage for more than 63 days. For every month you delay enrolling, Medicare adds a 1% penalty that accumulates and remains for life, month to month. Now, one common misunderstanding is assuming that COBRA counts as credible coverage for Medicare. Unfortunately, COBRA is not considered credible by Medicare. So delaying Medicare because you're on COBRA could still trigger significant lifelong penalties like the ones mentioned just a minute ago. If you're working past 65 and have employer coverage, you'll be eligible for a special enrollment period when you finally retire. So you have an 8-month window after leaving your job and your job-based coverage to enroll in Part B without a penalty. However, Part D prescription coverage has a much shorter time frame, only 63 days after losing coverage. If you miss these windows, you will have to wait until the general enrollment period, which is from January 1st through March 31st, and penalties could unfortunately apply. So let me tell you why timing is critical here, because these penalties aren't just inconvenient. They can be financially painful over time. So for example, if your monthly premium is typically $185, a 20% penalty for a 2-year delay would mean that you would pay an additional $37 every single month for the rest of your life. So over the years, this significantly adds up. The bottom line here is that missing your Medicare deadlines isn't a small mistake. It is actually a costly, lifelong financial burden. Always make sure that you understand your enrollment periods very clearly, and if you're confused, just reach out and ask. Getting expert help early can save you a lot of stress and money later on. Now let's talk candidly about some major limitations of original Medicare, which is Parts A and Part B alone, because many people are surprised by these. So number one, there's no maximum out-of-pocket limit. That means original Medicare doesn't cap how much you could pay in 1 year, potentially leaving you exposed to extremely high medical costs in case of serious illness or injury. So every time you're hospitalized, you will owe that Part A deductible again and again if there's been a 60-day gap between your hospital stays. Additionally, after 60 hospital days, so 60 days being in the hospital, you'll pay daily co-insurance fees, which increase significantly and can drain everybody's finances quickly. And here's another one. After you've met your Part B deductible, you're still on the hook for 20% of your medical bills with no upper limit, no maximum. So imagine needing expensive treatments like chemotherapy, for example, or surgery. These costs can quickly become overwhelming without having additional coverage. Also, keep in mind that original Medicare doesn't cover common services like routine dental, eye exams, glasses, hearing aids, and this can leave you paying entirely out of pocket for essential healthcare needs. But don't worry, there is a solution. To address these significant gaps, most people choose supplemental coverage of some type, and we're going to briefly outline your two main options. Number one, Medigap plans or Medicare supplement insurance. These policies help cover the gaps in original Medicare, and depending on the plan chosen, Medigap can pay deductibles, co-insurance, and co-payments. And it also gives you predictability in your healthcare costs and usually allows you to see any doctor who accepts Medicare. Just a lot of freedom when it comes to doctors. Option number two, Medicare Advantage plans or Part C. These are definitely an alternative to original Medicare, and they're offered by private insurance companies. Medicare Advantage plans usually combine medical, hospital, and prescription drug coverage into one convenient plan, and additionally, they often include extra perks like dental, vision, hearing, plus they actually have a maximum out-of-pocket limit, and it protects you from excessive costs. It's a great benefit to have. So deciding between Medigap and Medicare Advantage is going to depend on several things like your lifestyle, your budget, your healthcare needs, and really just preferences around choice and convenience. Medigap offers a broad choice in healthcare providers, but typically higher premiums, while Medicare Advantage generally has lower monthly premiums, a network of providers, and some added benefits, but potentially more restrictions when it comes to providers. So the takeaway here is critical. Don't leave yourself financially vulnerable by relying solely on original Medicare. Always carefully evaluate your options to ensure that you're adequately protected. Before wrapping up, please remember, everyone's healthcare needs are unique. Always, always, always review your specific situation, considering costs, coverage, and convenience, because Medicare decisions can feel complicated, but with clear guidance, you can confidently choose what is best for you. So that wraps up today's coverage confessions. Let me tell you, turning 65 and navigating Medicare decisions doesn't have to be so brutal. I really hope that today's discussion clarified your options and actually gave you some peace of mind. So if you still have questions though and need personalized guidance, please reach out. And if you found this video helpful, you know the drill. Like, subscribe, share. It can help others make informed decisions as well. So until next time, take good care of yourself and may your next Medicare decision be one that you're truly proud of.